last session, we defined the medical system as this empire-building medical, industrial, militaristic complex. For us, it's pretty clear what is happening today, and we also know that we're on the verge of massive change in healthcare because we all know about it every single day, and every single paycheck, and everything in the news is about changing our healthcare system as it exists today. So what we visualized in the future as our prototype was this attempting to adapt to change and making visible that which already exists. So as we started talking about how this plays out in our own university, okay, in terms of the networks and the structures that already exist, you know, the big players, you know, in this complex are UMP, Fairview Hospital Systems, and then the University of Minnesota as described within the Academic Health Center and all the big schools of the Academic Health Center. And so our own internal system continues to build the system that we're trying to get away from. So then there's a bunch of us down here at the bottom, and we could have filled in lots of different little things down here that are really trying to do this community-engaged, healthy communities initiatives, okay? So Center for Spirituality, which some of you know about, Cook, Employee Assistance, Boynton, Public Health, there's just all kinds of, I think people have mentioned it before. So we're very disconnected today. Not that we can change this system, but there's ways that we believe through a community-engaged strategy that we can begin to adapt to the changes that are coming in our ways.
So our proposal is to take that hierarchy and siloed vision and kind of turn it around to say the center is really creating this healthy community. And here are the players in this inner circle that are really have that kind of focus, are involved in that, and how we partner with others and look at more of a community health, population-based health approach to address these issues. And then there's layers out from that are doing specific components of that, but that we all continue to think of this in the context of being part of this creation of a healthy community where people can thrive and reach their full potential and be successful. And that kind of model, with this being the hub, is kind of what flowed into as we look at, well, then how do we apply that as an agenda?
Our community engagement efforts are kind of catalyst to the services we provide within the communities. And then we saw interprofessional education and research tied to our service missions. And then one example of our efforts kind of stemming from more of our network building here is One Health, and it's a new group that's organized with medical school, dentistry, social work. We're bringing kind of all our middle management together and organizing boots on the ground efforts to provide more cross-disciplinary educational opportunities, interprofessional educational opportunities for our students that are more triple A minded. So we're providing quality care that's patient-centered, that's looking at reducing the costs of our healthcare. And so really, we're actually understanding what we're all doing. We looked at all our affiliation agreements, and we noticed that, hey, we have pharmacy, nursing, dental, and medical students all at the same clinic. Why aren't we organizing our efforts? Why aren't we getting those students together to look at patient health as a whole?
As we look at pulling together all of these entities and working better together for health, it's also with all of you also. It just permeates all of our work. And so whether it's equity and diversity and health disparities, it's transportation and safety, it's healthy food choices and nutrition, it's looking at all those kinds of relationships that the anti-poverty group and the impact that has on health, and that how do we all continue to work together toward creating that kind of vibrant community where we can all flourish and do our best.
I just applaud the shift from healthcare to healthy communities. I mean, that when we recognize that healthy communities mostly come from things beyond healthcare, you know, that shifts the power in some really important ways. So I think that's great, and it was interesting with the example of One Health that's figuring out how to do the healthcare, the services more differently, but thinking about, I just wonder, is there some something that could emerge together that's more around that healthy communities. Not that the services don't contribute to it, but that has that other
Similar type
perspective.
of branding and initiative around that, with that being the focus.
Yeah.
I think that we talked about that, we have a national agenda right now on what all healthcare is supposed to do, called the Affordable Care Act. So it's not like we get a lot of choices in this. This is a national agenda and this is the way it's moving. And so as we begin internally, some of the real important aspects of healthy community and how as we internal to the university become a healthy, develop that. We need to just start building our own relationships. We just don't have a lot of relationships among people who are really doing healthy community. We just don't. And then get the middle managers together, because deans can make all kinds of great statements, but we really need people who are doing the work to get together and get to know each other, because they really know how to implement it. And then there's got to be some, maybe even some co-location or coming together in different ways than we've done before, or even we need to set clear priorities about what it is in it. The healthiest community research is huge and vast. And so how do we actually implement that as a network within the university? It's pretty hard to separate this to us, it's really a them, us issue. And so it's not like we want to break this down, but we want to figure out how this works in a community engaged way through engaging the community. It's really hard to disengage this.
Yeah, I just wanted to mention regarding the working together of the different health team members, that we are this center for the interprofessional education through the office of Dr. Barbara Brandt, and making our students work together in the different clinics, but also that the measures for health, we are really disease-oriented in terms of our healthcare and the emphasis on healthy communities. So even the way we will be reimbursed for insurances will change. Not about, in dentistry, for example, we're not going to be assessed according to the number of fillings or crowns or dentures, but what is it that we have done, measurable outcomes in the communities, not procedures, but in terms of health measures in the community. And so the dentist will probably be screening for obesity and diabetes, etc., and the doctor will be screening for oral health problems among children. So there really going to be an interprofessional work.
The university is the only center across the whole United States that got funded to do this, and so it's really, we could capitalize that on in a very big way.
Take on the insurance industry,
Right,
so that communities are part of it, and understanding it. That directs so much of this.
With the employee wellness is around looking at the research and insurance companies seeing that there is a return on that investment. If they're going to put it, incentivize it financially, then that we can use that as a part of it also. Also looking at incentivizing based on, similar to if we're always treating the symptoms, we're always going to have jobs. And so looking at the root causes of health and well-being, and in the same sense, we've been talking to President Kaler and his strategic plan, that if your goals are institutionally are for students to be successful and persist and graduate and reach their full potential, you've got to look at these issues, and not just when they come in the door, but working with the community as they're developing and growing up, and what are those issues to help them be successful and stay in school.
I'm a total health outsider, first of all. So, but from an organizational perspective, I'm stuck on moving from here to from the first model to the second model. And I think you've really identified what the drivers are, and we might all bemoan those drivers right now, but we understand they're the drivers. So if we want to transform organizationally to a model that's centered around healthy communities, is that really going to drive organizational change? Is there funding behind that? Is there an impetus? And what occurs to me is that you might think about, what's driving the discourse right now? And you've already identified it. You've talked about, inequality and access, Affordable Care Act. And is there a way that we can position those sort of discourse drivers at the center of this in a way that more realistically will result in a sort of change in how we're organized, that aligns with where the funding is coming from, and what you cited was, we know this is the inevitable future. And I think I support the idea of the healthy communities as a theory and a concept, but I don't know if that's going to appeal to those decision makers who drive our organizational structure in a way that some of the more concrete external factors might. So just a thought.
And two things around the model from the previous is one, it's going bankrupt. We cannot sustain it financially, so something has to change. And two, we're not getting good health outcomes. When we rank 27th or whatever in the world on some indicators, it's not working and we can't afford it. And so things have to change. Let's look at the research and the data to drive where do we try and go and how best to get there. So people are more open to considering doing something different if the current model is falling apart.
Yeah.